281. A client with a sports injury undergoes a diagnostic arthroscopy of his left knee. After the procedure, the nurse assesses the client's leg. Which assessment factors are the priority? 1. Wound and integumentary assessments. 2. Mobility assessment. 3. Vascular and integumentary assessments. 4. Circulatory and neurologic assessments. Answer: 4. Following a procedure on an extremity, nursing assessment should focus on neurovascular status of the extremity. Swelling of the extremity can impair neurologic and circulatory function of the leg. After the neurovascular stability of the extremity has been established, the nurse can address the other concerns of skin integrity, mobility, and pain. 282. A client undergoes a lumbar puncture for a myelogram. Shortly after the procedure, he reports a severe headache. What should the nurse do? 1. Increase the client's fluid intake. 2. Administer prescribed antihypertensives. 3. Offer roll lenses to the client. 4. Place cooling packs over the lumbar puncture site. Answer: 1. Headache following a lumbar puncture is usually caused by cerebrospinal fluid, CSF, leakage. Increased fluid intake will help restore CSF volume. Antihypertensives don't address the problem. Roll lenses reduce light irritation to the eyes and ice may reduce sight pain, but neither intervention addresses the problem of reduced CSF volume, which caused the headache. 283. A client with osteoarthritis develops coagulopathy secondary to long-term nonsteroidal anti-inflammatory drug, NSAID, use. The coagulopathy is most likely the result of 1. Impaired vitamin K synthesis. 2. Blocked prothrombin conversion. 3. Decreased platelet adhesiveness. 4. Factor VIII destruction. Answer: 3. NSAIDs reduce platelet adhesiveness and can impair coagulation. They don't impair vitamin K synthesis, block prothrombin conversion, or destroy factor VIII. 285. A nurse is teaching a client with osteoarthritis about lifestyle changes. The nurse knows the client understands the teaching when she states that she will 1. Avoid exercise. 2. Restrict caffeine. 3. Abstain from alcohol. 4. Lose weight. Answer: 4. Osteoarthritis, degenerative joint disease, is a disorder caused by wear and tear on the joints. Excess body weight is a risk factor associated with the development and progression of osteoarthritis. Weight reduction can decrease the manifestations of osteoarthritis. Certain aggravating exercises may need to be avoided, but exercise can be beneficial. Caffeine isn't associated with clinical manifestations of osteoarthritis. Alcohol intake isn't prohibited. 286. A client with a sports injury undergoes a diagnostic arthroscopy of his left knee. After the procedure, the nurse assesses the client's leg. Which are the priority nursing assessment factors? 1. Wound and skin. 2. Mobility and sensation. 3. Vascular and integumentary. 4. Circulatory and neurologic. Answer: 4. After a procedure on an extremity, nursing assessment should focus on neurovascular status of the extremity. Swelling of the extremity can impair neurologic and circulatory function of the leg. After the neurovascular status of the extremity has been established, the nurse can address the other concerns of skin, mobility, and pain. 287. A nurse is walking in a local park and witnesses an elderly woman fall. The woman reports severe pain, has difficulty moving her left leg, and is unable to bear weight on the affected leg. The nurse notices her left leg appears shorter than her right. The nurse suspects a femoral fracture. The greatest risk to the client is 1. Infection. 2. Fat embolus. 3. Neurogenic shock. 4. Hypovolemia. Answer: 4. The greatest risk to the client with a femoral fracture is hypovolemia from hemorrhage, which may be covert and can be fatal if not detected. Infection and fat emboli are potential complications less frequently seen in femoral fracture. Neurogenic shock isn't directly associated with femoral fracture. 288. A client is undergoing rehabilitation following a fracture. As part of his regimen, the client performs isometric exercises. Which action provides the best evidence that the client understands the proper technique? 1. Exercising of bilateral extremities simultaneously. 2. Periodic monitoring of his heart rate. 3. Forced resistance against stable objects. 4. Swinging of limbs through full range of motion. Answer: 3. Isometric exercises involve applying pressure against a stable object, such as pressing the hands together or pushing an arm against a wall. Exercising extremities simultaneously isn't a characteristic of isometrics. Heart rate monitoring is associated with aerobic exercise. Limb swinging isn't isometric. 289. The nurse is doing preoperative teaching with a client who's admitted for hip replacement surgery. Which statement by the client indicates the need for further preoperative teaching? 1. I'll begin gait training within 48 hours. 2. I'll rest in bed for 2 to 3 hours after surgery. 3. I need to turn, cough, and breathe deeply every 2 hours. 4. I should do muscle strengthening exercises in both legs. Answer: 2. After total joint replacement, few clients can get up 2 to 3 hours after surgery, although most are out of bed within 24 hours of surgery. The other options indicate that the client understands the nurse's preoperative teaching. 290. A trauma client reports tingling and severe pain in his cast right leg. When the nurse inspects the exposed toes, she notes cyanosis. What should the nurse do? 1. Apply a heating pad. 2. Elevate the extremity. 3. Notify the physician immediately. 4. Ask the client to wiggle his toes. Answer: 3. The nurse should notify the physician immediately. Severe pain, tingling, and cyanosis are signs that the client's circulation is impaired by the cast, causing tissue ischemia. The cast should be removed immediately to relieve the pressure and prevent tissue damage. Applying a heating pad, elevating the extremity, and asking the client to wiggle his toes would delay treatment, further compromising the client's condition. 291. A client returns from an endoscopic procedure during which he was sedated. Before offering the client food, it's most important for the nurse to 1. Monitor his oxygen saturation levels. 2. Assess his gag reflex. 3. Place him in the side-lying position. 4. Have him drink sips of water. Answer: 2. The sedation associated with a procedure, such as endoscopy, can impair the gag reflex. If a client is fed before the gag reflex returns, the client can experience airway obstruction and aspiration. Therefore, the nurse should assess the client's gag reflex before offering the client food. Monitoring hemoglobin saturation levels is important after an endoscopic procedure, but its results won't support feeding the client. In this situation, the side-lying position isn't necessary. Having the client drink water isn't the proper method of assessing for a gag reflex. 292. A client with a history of hiatal hernia reports to the nurse that he has trouble sleeping because of abdominal pain. It would be most beneficial to the client if the nurse instructed him to sleep. 1. With his upper body elevated. 2. In the prone position. 3. Flat or in a side-lying position. 4. With his lower body slightly elevated. Answer: 1. Upper body elevation can reduce the gastric reflux associated with hiatal hernia. Lying prone, flat, on the side, or with the lower body slightly elevated won't benefit the client. 293. A client with peptic ulcer disease secondary to chronic nonsteroidal anti-inflammatory drug, NSAID, use is prescribed misoprostol, Cytotec. The nurse would be most accurate in informing the client that the drug 1. Reduces gas formation. 2. Increases the speed of gastric emptying. 3. Protects the stomach's lining. 4. Increases lower esophageal sphincter pressure. Answer: 3. Misoprostol is a synthetic prostaglandin that, like prostaglandin, protects the gastric mucosa. NSAIDs decrease prostaglandin production and predispose the client to peptic ulceration. Cytotec is prescribed to clients with peptic ulcer disease who are also taking NSAIDs. Misoprostol doesn't reduce gas formation, improve emptying of the stomach, or increase lower esophageal sphincter pressure. 294. A nurse is reviewing the diagnostic data of a client suspected of having gastric cancer. What laboratory finding is the nurse most likely to find? 1. Elevated levels of hemoglobin and hematocrit. 2. Negative fecal occult blood test. 3. Subnormal gastric hydrochloric acid level. 4. Negative carcinoembryonic antigen, CEA, test. Answer: 3. One manifestation of gastric cancer is achlorhydria, an absence of free hydrochloric acid in the stomach. In gastric cancer, a subnormal hemoglobin level and hematocrit is most likely, fecal occult blood test is most likely to be positive. The CEA test would most likely be positive in gastric cancer. 295. A physician orders gastric decompression for a client with small bowel obstruction. The nurse should plan for the suction to be 1. Low pressure and intermittent. 2. Low pressure and continuous. 3. High pressure and intermittent. 4. High pressure and continuous. Answer: 1. Gastric decompression is typically low pressure and intermittent. High pressure and continuous gastric suctioning predisposes the gastric mucosa to injury and ulceration. 296. A client with Crohn's disease has a serum potassium level of 3.1 milliequivalent/dl. The client is prescribed 30 milliequivalent of oral potassium chloride, Kalor, twice daily. The nurse should plan to give the supplement 1. With food or after the client eats. 2. On an empty stomach. 3. Along with no other medications. 4. 2 hours before or after eating. Answer: 1. Supplemental potassium can be irritating to the esophagus and stomach and is best tolerated with or shortly after meals. It's typically appropriate to give oral potassium at the same time other medications are being administered. 297. A nurse is evaluating the effectiveness of dietary instructions in a client with diverticulitis. Regular consumption of which food would indicate that the client hasn't understood the instructions? 1. Fiber. 2. Bananas. 3. Cucumbers. 4. Milk products. Answer: 3. In diverticulitis, vegetables with seeds are prohibited in the diet because the seeds can lodge in diverticula and cause flare-ups. Fiber and residue are recommended in the diet. Bananas and milk products aren't contraindicated. 298. A client with a history of peptic ulcer disease develops a fever of 101 degrees Fahrenheit 38.3 degrees Celsius. Which accompanying sign most strongly indicates the client has peritonitis? 1. Leukopenia. 2. Hyperactive bowel sounds. 3. Abdominal rigidity. 4. Polyuria. Answer: 3. Abdominal rigidity is a classic sign of peritonitis. The client would more likely have leukocytosis, hypoactive bowel sounds, and decreased urine output. 299. Daily abdominal girth measurements are prescribed for a client with liver dysfunction and ascites. To increase accuracy, the nurse should use which landmark? 1. Xiphoid process. 2. Umbilicus. 3. Iliac crest. 4. Symphysis pubis. Answer: 2. The proper technique for abdominal girth measurement involves circumventing the abdomen with a tape measure using the umbilicus as a landmark. Using the xiphoid process, iliac crest, or symphysis pubis would give inaccurate measurements. 300. The nurse is assessing a client with hypothyroidism and finds the client has a temperature of 94 degrees Fahrenheit 34.4 degrees Celsius and exhibits hypotension and hypoventilation. Based on these findings, which nursing diagnosis is most appropriate for this client? 1. Impaired gas exchange. 2. Hypothermia. 3. Disturbed thought processes. 4. Deficient fluid volume. Answer: 1. Hypothermia, hypotension, and hypoventilation are manifestations of myxedema coma, a potentially life-threatening complication of hypothyroidism. Impaired gas exchange is the most significant nursing diagnosis because a client with myxedema coma may suffer from hypoventilation, bradypnea, and respiratory failure caused by respiratory weakness and coma. Ensuring and maintaining a patent airway always takes precedence. Hypothermia occurs in a client in myxedema coma due to decreased metabolism. Disturbed thought processes may result from reduced cerebral perfusion secondary to reduced cardiac output. Deficient fluid volume may result from impaired free water clearance.